As we all know, it involves not just multiple joints, but it has an involvement of multiple systems. It involves the skin, eyes, lungs, blood vessels, and as it's already explained, it has 60% increase in the risk of cardiovascular disease and related deaths. This is the video, please. And we go to the pathology of rheumatoids. And
the pathologic hallmarks of rheumatoid arthritis include inflammation of the joints, particularly the small joints in the hands, wrists, and feet, accompanied by cartilage destruction and bone erosion. Underlying inflammation leads to many of the characteristic signs and symptoms of RA, such as pain and swelling of the joints. Inflammation results from abnormal propagation and activation of many types of immune cells, resulting in the secretion of cytokines and other mediators that sustain and amplify the inflammatory environment. As a key pro-inflammatory cytokine, TNF-alpha, along with other cytokines, activate immune cells, including macrophages, as well as other cells, such as synovial fibroblasts. In a key step, activated macrophages and synovial fibroblasts release pro-inflammatory cytokines, including TNF-alpha, IL-1, and IL-6, and mediators of vascular growth, including VEGF. VEGF is essential to the process of blood vessel proliferation, or angiogenesis, which facilitates an influx of activated cells. These cells contribute to the growth of pannus and sustain the inflammatory cycle. The growing, vascularized pannus develops villous projections that result in better access to the cartilage and bone, and therefore greater opportunity for the activated cells to release damaging inflammatory mediators and enzymes. In the interface between pannus and cartilage, activated synovial fibroblasts and macrophages are a source of enzymes that degrade the cartilage matrix. These include MMPs, or matrix metalloproteinases. Thus, activated cells in pannus are key instigators of cartilage destruction. Chondrocytes are the main cellular component of cartilage and normally produce the extracellular matrix. However, in response to stimulation by TNF-alpha, IL-1, and other inflammatory mediators, chondrocytes become activated in the rheumatoid joint. Activated chondrocytes secrete more inflammatory factors and more metalloproteinases, MMPs, which aggravates inflammation and cartilage damage. The cumulative result is irreversible cartilage damage and joint space narrowing. Under normal conditions, bone remodeling involves a tightly regulated balance between bone resorption and bone formation. However, excessive TNF-alpha helps stimulate osteoclastogenesis and bone destruction. In the marrow, TNF-alpha helps stimulate monocyte differentiation into osteoclast precursors. At inflamed joints, in the presence of macrophage colony stimulating factor, TNF-alpha, and rank ligand, osteoclast precursors differentiate into mature osteoclasts, resulting in bone resorption. Thus, the direct and indirect effects of the TNF-alpha on osteoclast maturation and activation culminate in focal bone erosions and irreversible joint damage.
That it's an inflammatory arthritis, and TNF-alpha is the mediator for cartilage, and ultimately nuclear factor kappa is released, and this is important because that acts as a master switch to turn the inflammation on and off, and that is the crux of the pathogenesis, because it takes part in the disorders leading to various spondyloarthropathies, rheumatoids, psoriatic arthritis, etc. So it is the main pathogenesis. It has already been explained, the activation of the nucleus and translocate in the activate in the nucleus and release in the inflammatory mediation. And here it plays a crucial role in the synovium membrane formation of chondrocytes, which leads to cartilage destruction, osteoclastogenesis, which leads to bone destruction. And so what we have to stop is the nuclear factor. Curcumin, it's a biological active. It possesses anti-inflammatory, antioxidant, anti-proliferative, and anti-angiogenic properties. So it controls this nuclear factor. As it has been explained, it blocks the various stages where the nucleus factor acts and leads to ultimate osteoarthritis. So there are various studies going on. The comparative study with diclofenac, it is effective and safe in patients with active rheumatoid arthritis. There is significant reduction in the level of C-reactive proteins. It is also effective and well tolerated during the treatment of it because it has better GI tolerability. Curcumin relieves pain and reduces the need of NSAIDs. As just we discussed, the dosage of associated use of NSAIDs is reduced. It also has a comparative study along with ibuprofen. That is again better GI tolerability. It is effective for long-term therapy of osteoarthritis. In many of these conditions do need long-term therapy. Another study with curcumin along with diclofenac, the dosage of diclofenac is reduced and the effect is enhanced, giving better pain relief when it is used along with diclofenac. And this is again given with celecoxibs, which enhances, as has been repeatedly shown in various studies, that when given with methotrexate and prednisolone, the side effects of these prolonged drugs is reduced, along giving with better side effects. It is safe, as it has been emphasized by the previous speaker. It is generally recognized as safe. This is the term used commonly by various drugs. It has less side effects in renal hepatic diseases. So the patients having impaired functions, this can be used very safely. So this is a new study. The clinical trials have been taken, and it is bioavailable, effective, and well-tolerated curcumin formulation is now available because of this self-micro-emulsifying drug delivery system which has been developed, which gives rise to good bioavailability. The dosage is perfect. It reduces the associated use of NSAIDs. Majority of the patient have mild to moderate inflammation, usually respond 100 to 200 milligrams per day, but you can increase the dose till 400 milligrams a day. So it is suitable option because it decreases the release of inflammatory prostaglandins and it blocks the major factors. It can be safely used with along with NSAIDs, steroids, methotrexate, and it is a particularly useful option when these drugs, the associated drugs, cannot be used in a higher dose or absolutely cannot be used. So we all work hard to make pain-free life, everybody. Thank you very much for your attention.